Hello everybody, welcome to the COVID-19 vaccine Q&A for children between the ages of 12 and 15. We're just going to give it a few minutes whilst we wait for people to join the webinar, so bear with us for a moment. Thank you. Okay, hello everybody, let's make a start. So once again, welcome to today's COVID-19 vaccine Q&A information session. We're going to be focusing on vaccines for children between the ages of 12 and 15. So welcome to the session. The purpose of the session is very much to provide you with accurate, open and transparent and honest information about vaccination for COVID for this age group of children. Please feel free to ask any question within the chat function of Teams. You can find the chat function by clicking the little speech bubble icon, which is probably at the top of your screens. We've got a group of local professionals here today who are going to be answering your questions. So I will just introduce myself and my colleagues now. So my name's Dudu Shah-Arami and I'm the Director of Public Health at Enfield Council. So we've got a few council colleagues here. Louisa, would you like to introduce yourself?
Good afternoon, everyone. My name is Louise Borley. I'm also part of the public health team here at Enfield Council.
Thanks, Louisa. And Ngozi?
Hi, I'm Ngozi Omolaye. I'm part of the communications team and my focus is on COVID vaccination communications. Thank you.
Thanks,
nice to see you all.
Thanks, Ngozi. And Michelle?
Hello there, my name's Michelle Goldring. I'm the team lead for the school-aged immunisation service in Enfield.
Thanks, Michelle. And last but by no means least at all, Belinda.
Good afternoon, everybody. Thank you, Dudu. My name is Belinda Dancer Langley. I am the service lead for a group of children's services within Enfield, of which immunisations is one of.
So just before we start, I'm going to hand over to Louisa, who's going to tell you a little bit about how the session's going to run. Over to you, Louisa, thanks.
Thanks, Dudu. So hi everyone, we just have a few housekeeping rules before we start. So as you may be aware, your microphones and video cameras are turned off. It's only our panel members, Dudu, Michelle and Belinda, who are able to speak. But we really would welcome all of your questions and comments into the chat box. So please do so throughout the webinar, ask any questions you would like and we'll do our best to answer them within the time available. Please be aware that the webinar is being recorded and it will be published online for those who are not able to attend today. But as your cameras are off, please do not worry about that. If you are disruptive in the chat, which I'm sure you will not be, we do have the power to remove you from the webinar just to ensure things run smoothly. And just please do avoid posting questions in the chat that have already been asked. Instead, we'd like you to give a thumbs up just so that we can see which questions most of you here are interested in answering. Please do not post any links to external websites or any offensive content. That's all for the webinar, so I'll now hand it back over to our panel to begin. Thank you.
Thanks, Louisa. So I think this is a really important topic for us for here in Enfield. we know that the vaccine uptake for 12 to 15-year-olds, whilst we've had several thousand 12 to 15-year-olds who have been vaccinated, there are many, many more who haven't. So we're very keen to really increase our vaccine uptake because we know that vaccination protects and is the best way of protecting against COVID infection. I think some of the really important issues for young people and vaccination is whilst young people's initial COVID infection is often very mild. However, they can be affected by long COVID, and certainly when a young person tests positive, it results in quite a considerable amount of time off school, and if there is onward transmission, that can also affect schools' ability to really maintain good face-to-face education for our young people, which is so important for their mental well-being and other aspects of their lives as well. So without further ado, I'm going to hand over to our colleagues Michelle and Belinda, who are going to mention a few words just about how the vaccination programme works and talk us through that. Thank you. Over to you, Belinda and Michelle.
Thank you very much, Dudu. So before we go into the questions and answers, I know that there's been lots of news and lots of noise and lots of useful information coming through nationally, but we really wanted to tell you about how we're managing the delivery locally here in Enfield. So the immunisation service is a school-age immunisation service, and we don't just immunise for COVID. We've been immunising your school-age children for flu, for HPV, and all the other national programme. And now we've got the added joy of delivering the COVID vaccinations as well. So for the 12 to 15-year-olds who are extremely clinically vulnerable, they will be vaccinated by the primary care network, so by their GPs. We're focusing on the healthy 12 to 15-year-olds, and we started this programme on the 22nd of September. So far, as Dudu has said, we've managed to vaccinate over 3,000 school-age children in this cohort here in Enfield. And there are many, many more who are now booking onto the national booking system, which we'll give more information about later on. So previously it was one dose for your 12 to 15-year-old when we started in September, and what JCVI have done on the 28th of November is authorised and signed off on us giving second doses. So all the children who've received their first dose 12 weeks after the first dose, which will be round about the 20th of December, will be eligible to actually start receiving their second vaccinations. What we're doing here in Enfield is, though the national booking system will be open from Monday for anybody to book into, we're also looking at some of the schools that weren't able to take part earlier on in the programme, where we had lots of low consent. So we will be, our team, Michelle and 17 of our colleagues, all very well trained nurses and administrators, will be focusing on the areas where we had very low consent, and we'll be going back into those schools. And so far we've identified around 12 schools and 6 of all of our special schools here in Enfield. And the programme will be the same as before. If there are other vaccinations booked, such as flu, HPV, we'll be able to come along on those same dates. But I must mention that consenting to your child having the flu vaccine or HPV or any other vaccination, even though we're there and we can deliver COVID, we will not administer COVID without your consent as a parent or a carer. The team are very well versed in managing children who have needlephobias, children who are worried, who need a little bit of a chat and some time before that. And we can speak to parents in advance. So even after you've consented to your child having the vaccination, you can still ring our immunisations team if you have any questions, And on the day of, when we're there to vaccinate your child, and if your child tells us that they don't want to have the vaccine or you've changed your mind, we'll work with you and we're not going to go ahead, and we'll have a further conversation with you. I think, you know, all I can say is that there has been millions and millions of children worldwide who've now had the vaccination. It's helping to reduce transmission along, you know, across that age group, even though, as Dudu has said earlier on, they are not being adversely affected health-wise. They are affected in lots of other ways in terms of their education, their development and their social development as well. Thank you.
So Belinda, I just wondered whether it is useful for parents to have an idea about what happens on the day of the vaccination on school, you know, maybe what happens when you send the consent to them, how they get the consent back, and then what happens with the children on the day of the vaccination. If you could talk us through that.
Michelle, do you want to talk? Yeah, sure. So once we have the consent form come back, if there's anything on the consent form that we need to double check with a parent, we will do that before the session. So in the week running up to the date of the immunisation session, and that's why we do ask for the consent forms to come back sort of 48 hours beforehand to give us time to check all the forms. So we want to make sure that everything is perfect for the day. So if there's anything that we need to discuss further, we will do that. So we'll call the parent. On the day, obviously, we will turn up at the school. The schools are fully aware that we're coming. They give us an appropriate room for us to go into. We tell them how many staff we're sending so that everybody is nicely socially distanced and that it's safe and appropriate to have the children there. Obviously, our vaccines are kept at a perfect temperature to be given on the day. And the children are brought down in a beautifully orderly fashion by the teachers. It's a real team effort. We're all there. We have stickers galore. Even everybody wants a sticker, to be quite honest. Who doesn't love a sticker? So yeah, on the day we will go through the questions again with the child to make sure that everything hasn't changed, because obviously sometimes between the parent consenting and the day of the actual immunisation, some things can change. So we do make sure that all the information is still correct, and once we know we've got the right child, obviously we will go ahead and give the vaccination, and then they are closely monitored for about 15 minutes afterwards. So we keep them in the same room with us. And sometimes we ask for some feedback as well, because it's really important to actually get feedback from our children as to what we're doing right and what we can improve on. So we're always happy to hear that. And then the children are allowed to go back to school. Yeah.
Thank you. Excuse me. As I mentioned before, we know that infections, the infection rate is really high amongst school-age children at the moment. Locally, last week we had an infection rate amongst our sort of under 20s of around 437 per 100,000. This week, that rate has doubled. So we can see that we are coming into a new wave of infection, and it is doubling really quickly, as many people have probably heard in the national news. What that means is that lots of young people are getting COVID now. If somebody's had COVID very recently, can they get their vaccine, or do they have to wait? What's the period of time that they have to wait for their vaccine?
So when we first started the programme, the agreed period of time was 4 weeks before they have their vaccine. This has now been revised and we've now gone to 12 weeks. So if somebody's had a positive COVID test, we will not vaccinate for another 12 weeks, which is equivalent to about 3 months.
Great, thank you. Also, I know what some of the questions that we've had before on webinars are if somebody has a child who's just under the age of 12, but they're very keen to be vaccinated, can they come forward?
I know that's a really, really good question, and we've been asked that many, many times. In fact, we've had telephone calls to the IMS line asking if their children can have the vaccine. We're going by JCVI guidelines and the chief medical officers of the 4 nations, and currently we've been signed off to administer to 12 to 15-year-olds. So I know that in year 7 there were some 11-year-olds who were literally just about to turn 12 the day after we've been to some schools, and we weren't able to vaccinate those. Not because we're not willing to, but because at the moment that's what's been agreed by NHS England, and I think that's going to remain the same for the time being. I know that they are reviewing the under 11-year-olds, but we don't currently have a sign off. But as soon as your child does turn 12, please contact us or go to the national booking system and they'll be booked in to be vaccinated.
Fantastic, thank you. And I know it's quite confusing for people often because different age groups are sometimes have recently been entitled to just 1 vaccine or 2 vaccines, or, you know, some of the older age groups now also entitled to a booster. So for the 12 to 15-year-old age groups, what vaccinations are they entitled to in terms of COVID?
Thank you. Another good question, actually. And again, for some of those age groups that you've mentioned, there are different vaccines that are being used, such as Moderna and the Pfizer. For this age group, we're only authorised to use Pfizer. And for this age group, for a healthy 12 to 15-year-olds, currently it is 2 vaccines. So there's a first dose and there's a second dose 12 weeks later. For some of the clinically vulnerable in this age group, they're actually having 3 or 4 vaccines, but that's an individual conversation depending on their diagnosis with their GP or their primary health carer that will make that decision along with their consultant as to how many doses they have. But for 12 to 15-year-olds, healthy 12 to 15-year-olds, it's 2 doses of Pfizer.
Great, thank you. I know that, you know, being a parent myself, you know, when my children received their vaccine, I wanted to know about side effects. What could I expect, and you know, how could I best sort of take care of my children after their vaccine? Can you tell us a bit about that?
Yeah, so I mean, with many of the school-aged immunisations, the side effects can be the same. So it's likely that they will have a sore arm. They may get a slight raised sort of red area where the vaccination has taken place, which will be in the deltoid muscle, which is at the top of your arm. They could feel lethargic for a little while, so a bit sleepy, a bit tired, just generally a little bit under the weather. They may have a headache, and they may have a slight temperature, so a bit of Calpol, paracetamol to be taken sort of that evening is fine. Yeah.
And thank you, Michelle. I should add as well that for significant side effects, which we've had very, very few in England and Wales and the 4 nations, really, we have a very, very robust reporting system, the yellow card system. So if you do have any side effects, you can report that yourself on the NHS website, or you can give the immunisation service a call and we'll be happy to make that report on your behalf. But we've had very, very few since the programme started.
Yeah.
Thank you, that's great. Is there an observation period that children need to wait with you? I know that just recently, certainly for adults, the Pfizer observation period has been paused. Has that also been paused for this age group?
Not at the moment. I know it is under review, but they went with the adults pause first. The children's is still 15 minutes observation, but obviously if that changes, we'll adhere to that.
Yeah, great, thank you. I wondered what sort of questions you'd had parents phoning in with, and I think it'd probably be useful to share some of those sorts of questions in the chat in this conversation. And just whilst you're having a look at those, I'd just like to encourage our participants on the call to put any questions in the chat, and we will get those answered.
Thank you, Dudu. I mean, one of the areas that is very close to our hearts anyway, because we've got our 6 special schools here in Enfield, is children with special needs, ADHD, autism, all of those diagnoses, and how we manage those. So our 6, but the really unique system that we have here in Enfield is within our service, we also have a special school nursing service that are already providing health input in those schools. We also have the community paediatric service, who are the ones who are giving the diagnosis to the children. So across the system in BEH, we know our children and we know what their needs are. So when the immunisation service go into those schools, we already have that level of information. We will speak to parents, carers. We'll make sure that the children who have key workers who are very comfortable with them would have already done some work with them before we arrive. We have what the children call fake needles that they can play around with before we go, so there's no surprises. And we have our speech and language therapists who sometimes will use the talking mat with the children and make sure that they're comfortable before we vaccinate. Michelle, do you want to talk about that?
Yeah, I mean, it's not uncommon. So the team are fully trained up to deal with sort of all possibilities, and at the end of the day we do our very best to vaccinate them in school, and we talk that mummy and daddy would really like them to have it, but if they can't bring themselves to allow us to do it, we can offer clinic slots, so we try and give alternatives to the school environment wherever we can. So.
Great, thank you. I know that Louisa also had some questions prepared. Louisa, do you want to talk about some of those questions?
Yeah, sure. Thanks, Dudu. So to the panel, really. As we know, we're also in sort of the beginning of flu season, or in the middle of flu season, and some children may be eligible to have their flu vaccine or any other vaccine for that matter. And so we've had some questions about, is it safe to have the COVID vaccine alongside another vaccine? And so we'd like to ask the panel.
Good question. So when we first started the programme back in September, we were able to what we call co-administrate along with the flu vaccine for children. So what we were doing is, if Michelle's team were going into schools and they already had a flu date booked, we will do the COVID vaccination on those same days. And you can give both vaccinations at the same time, but obviously different consents. So if parent consents to flu, that's what we'll give. If they consent to both, then we'll do COVID and the flu. We've recently had that reviewed by JCVI, and we can now co-administrate with all other children's vaccinations. So we have been told that it's safe to co-administrate. So when we go back again, when schools open in January, we will be administrating along with other vaccines.
Great, thank you, Belinda. I just had another one around the development of the vaccine. So I know there's been, the vaccine was produced very quickly, and so just wanted to know if all of the safety procedures have been followed and all of the proper assessments of the vaccine have been followed to enable us to have it so quickly.
Yeah, and that's such a legitimate question, and I would not dismiss anybody that had those concerns. And this is for adults and for children, really. Let's not forget that the coronavirus has actually been around for a few years, obviously not COVID-19, but different types of viruses in that family. Vaccine development has been in place for many, many years. So though we got the vaccine last year, they didn't just start researching it last year. And let's not forget that the whole world have been putting all their efforts, all the scientists worldwide, not just in England, have been putting their efforts in getting us the vaccine and also making it safe. So it's legitimate to ask the question about how quickly it was developed. You know, I wouldn't, as I said, I wouldn't dismiss anybody, but we've had vaccines around for many, many years. And so far, more than 1 billion people worldwide have had the vaccine, and we haven't really had any reports of any serious side effects.
So I think another thing to add around that is that usually one of the things that takes such a long time in the development of vaccines is that there are required to be certain steps in terms of the research, and usually those steps happen one after the other, and because scientists saw that this was such an urgent issue, they were actually able to run each of those sections of the vaccine research in parallel with each other, which reduced the amount of time that the vaccines took to become licensed and to demonstrate their effectiveness in humans. So that was also a big part of why it seemed to take a shorter period of time. And let's not forget as well, there are many governments that threw huge amounts of money into establishing a workable COVID vaccination. I would only wish that they would be able to do that for other diseases across the country, across the world as well. But there was a huge level of resource and energy put into that, which helped to produce our vaccines quickly.
Yeah, that's very reassuring, and I think it's amazing what we can do when everybody puts the resources into something, which is great, so that we have the vaccine now. I've just got one final question for the panel, and that's around booster vaccines for children. I don't know if we know what the situation is with that, because given the recent announcements for adults, if that might be the same for children as well.
So no, we don't know just yet if there will be a booster program for children. In addition to that, there's also been the questions that we've been asked several times around an evergreen offer, in the same way that we're delivering flu year in, year out. In actual fact, this year we delivered flu to 4 additional school years that we hadn't done before. And so people are asking, next winter, will we be doing booster program for children for COVID in the same way that we do flu? The answer to that question is that at the moment we don't know. We've been asked to focus on the first and the second doses for this age group, and that's what we're going to do. But I'm pretty sure that in the next few months that we will find out from the those who are a lot more knowledgeable than we are as to whether there's going to be an evergreen offer of a booster program for children. But at the moment, the booster is reserved for all those adults in England over 18. So parents, when you're thinking about booking your child for their first and second dose, also consider having yourself booked in for your booster as well.
Thanks, Louisa. Those were great questions. I was just thinking that it would be useful, I think, for us to maybe talk through how parents can get immunisations for their children during the school holiday period, because I know that during term time it's so busy with work and school drop-offs and all sorts of other things like that. Maybe people have a little bit more time during the holidays to get their children booked.
Okay, so I'll talk about the wider system, and then Michelle will tell you a little bit about how you can book through the Enfield system. So the wider system, I'd mentioned the national booking system earlier on. This was not in operation for children back in September. They're now up and running. It is very, very smooth. I've booked my own 14-year-old through this system, and it worked really, really well. So throughout the school holidays, I think the only day that they're not operating might be on Christmas Day, but this might change. So I think they're open 7 days a week, actually. You can go into the system and book your child for their vaccination through the school holidays. And it's actually advised for teachers and children to get it done before the beginning of the school term, so that we don't have any more absences and whole school years who are self-isolating due to COVID infections. You go onto the national booking system, you put your child's name, the date of birth in there, their address, and then it will let you know which are the centres that are closest to you. But you can choose centres that are further away from you. It's really up to you. We have about 4 large vaccination centres here in Enfield that you can book through, or more. For us locally in the immunisation service, and Michelle will tell you a bit more about that in a minute, the last time during half term we were able to put on some clinics through the school holidays. This time round, because the notification came through too late for us to book anything for next week, we'll make sure that we have those clinics ready for you in February half term. But until then, you can book through the national booking system. So anything you wanted to add?
No, so obviously if your child is in one of the schools that we do return to during sort of January and February, and they for some reason miss that session, so if they're off sick or they just can't have it on that day, then yeah, again the clinics will be available. We'll try and put on at least a couple of clinics in the February half term and some clinics at the weekends as well, so there'll be lots of opportunity if they do miss it in school.
And we have been known to run clinics on a Sunday during the last one, yeah?
We do, yes.
That's great, thank you. And I've just actually put the National Booking Service link into the chat so that people are familiar with it. In terms of the questions that young people have asked you about their vaccination, has there been any sort of interesting or pertinent questions that the young people have been asking?
I mean, there's been quite a few questions around needlephobia, around how and parents are asking as well that if the child is quite nervous about the vaccination, how is the team going to manage it, and are we going to have time for them to take them through the steps and reduce the anxieties before the vaccination is given? And the answer is that Michelle's team are very, very well trained by our CAM psychologist team, and they know, they've been doing immunisations in schools for many, many years and know exactly how to manage those situations. So if anybody has needlephobia, do the consenting, but give us a call as well and let us know that your child needs just that tiny bit of extra time to get them comfortable before the vaccination goes ahead.
And are there any other sort of conditions or health issues that you would like to know about in advance of a child having their vaccination?
Yes, and in all the vaccinations that we give, not just COVID, we do ask this question in case there's any contraindications. So far, and lots of young people have asked these questions, and parents as well, if their child has serious health conditions, will the vaccine be safe for them? And if they have allergies, will the vaccine be safe for them? There has been research into this area, and there's no known serious allergy that would prevent them from having the vaccination. But we would always advise that if you do have a medical condition and you do have an allergy, have that conversation with your GP first. When you are doing the consent with us, and if you identify any health issues, and health conditions, we will have that conversation with you before we go ahead and we give the vaccination. You're on mute, Dudu.
Thank you. You'd thought that you'd think that I'd have learned by now. I was just trying to tell everybody that I've just put the link to your email address to the school-aged immunisation team in the chat, and also your phone number if people do have any sort of particular personal issues that they want to discuss with you in relation to getting their child vaccinated. And of course, important to say, it's not just the COVID vaccination that you deal with. So, you know, parents can contact you in relation to other vaccination queries as well. Are there, and I can't remember whether we've asked this question yet or not, but are there any conditions that would mean that a child wasn't able to be vaccinated?
Thank you, Dudu, and thanks for mentioning the other vaccinations as well, because we're very, very keen, just like COVID, to actually get our flu vaccination rates up in Enfield. Conditions where children would not be vaccinated, I mean, as I said earlier on, is always, there's a multitude of conditions that could have an implication on whether nobody would be vaccinating your child, but it might be preferable for the GP or another healthcare professional in a different setting to carry out those vaccinations. So all we ask is that please let us know, just highlight what it is, we'll have the conversation and we'll find the most appropriate way to get you vaccinated. If not by us, it will be another health professional. One of the other questions actually on health conditions is where some of the parents had asked us that, are there any situations where an 11-year-old could be vaccinated? And they were thinking about children who live in households where it's multi-generational. So there are other parents or grandparents in the home who may be clinically vulnerable. And obviously you've got the child going to school and coming back home. And I can say that our edict is for 12 to 15-year-olds, so we're not able to do that. But I do know that there has been occasion where a conversation with the GP or the child consultant has resulted in that special circumstance for them to be vaccinated. But that will be a clinical decision and a clinical conversation with their general practitioner.
Thank you, Belinda. I'd just like to encourage participants to put any questions in the chat. We are recording the session and we are also hoping to share it on social media so that others who haven't seen it can have a look. We haven't had any questions through, so Louisa, I just wanted to check with you that the chat function is working. It seems to be. Louisa is busy typing. Okay. Ngozi, did you have any questions that have come up through social media around the 12 to 15-year-old vaccination?
Yes, I'll just type in the chat now. Just a question around the children of asthma. I know with the question you asked Dudu about, are there any conditions that children cannot have the vaccine? So if they've got asthma, is it can they have the vaccine?
They can, and also with adults actually with severe asthma, they were actually encouraged to be vaccinated. They were one of the earlier groups that were targeted. So yes, they can, but obviously an individual situation will have to have an individual conversation. I wondered if while you were typing that, Ngozi, I could maybe talk a little bit about, because this age group is quite challenging in terms, you know, they do have autonomy in that age group. So it's not a case of where a parent will say, will consent and say they're having it and send them along without that conversation with that child. So I wondered if I could just give a few ideas on how parents could prepare their child before they've consented in order to have the vaccination. So, I mean, before the vaccination itself, it will be really good for you to ask your child how they feel, to make sure that they are calm and that they're comfortable with you consenting on their behalf, because on all other vaccinations for this age group, we actually use Gillick, where a child can consent for themselves. It is just for COVID that we're going by parental consent. But as I said earlier on, there is autonomy in this age group, especially with the 14 and 15-year-olds. Allow your child to ask some questions about the vaccination. It might help to reassure them that nothing bad is going to happen. You know, if your child wants you to be with them, obviously in school that's a bit more difficult, but the National Booking Service will allow you to come. In fact, they prefer for you to come along with your child. Ask them if they want somebody to talk to them during the injection. In terms of distraction methods, we like to know these things, and we're more than happy to accommodate, because there's usually more than one nurse there, so we can have one having a chat with them and the other one vaccinating. Ask your child if they will prefer for us to be quiet, if they don't want me and Michelle to be nattering in their ears while they're getting their vaccination, and we'll make sure that, you know, we accommodate them in that way. And lastly, we're fine for you to ask your child, do they want somebody to hold their hand for comfort while they're having the vaccination? It is a very, very quick process. In fact, I think it takes longer for us to reconstitute and make up the vaccine than it actually does for us to jab somebody. But, you know, for those 2 or 3 minutes, we recognise that there's lots of anxiety for these children beforehand sometimes, and we're happy for you to let us know after you've consented that when my child comes in, can somebody please hold their hand, and we're more than happy to accommodate. Thank you.
One of the questions that I've been asked in the past is, why do people, including children, need to have their COVID vaccine if they've already had COVID? And I think that's a really it's a really good question, and it's makes absolute sense to ask it. And the answer is that all of the evidence shows us that in actual fact we can see that people's immunity when they've actually had COVID is even better when they've also had their vaccination, which means that they've got even better immunity against COVID infection. And what we do know about the Omicron variant is that people who have had other types, other variants of COVID, whether that's Delta or right at the beginning when it might have been Alpha, their immunity has started to wane, and they can be infected with the Omicron variant. And so even if you've had COVID in the past, providing that it's not within that 3-month period, it is much more beneficial for you to go forward and have a vaccination, and that goes for children and adults, to really give your immunity a boost. Some of the other questions that we've had through are around, in terms of the ingredients of vaccinations, is there anything that would preclude people who are Muslim or Jewish or other faiths from having that? And I think one of the good things about COVID vaccinations is that there are no animal products within them. And so if your family use halal products or kosher products or anything like that, then that's not going to be an issue for you to have your COVID vaccination or your children's COVID vaccination. and many faith leaders have been working with us to kind of put this message out across Enfield. Belinda and Michelle, you'll probably be able to answer this next question better than I, but some people have also asked about whether vaccination changes your genetic material, because they've heard about the vaccination itself containing some genetic material. Certainly we know that it doesn't change the human genetic material at all, and whilst I can absolutely understand that you know, why people might ask that, it's not scientifically possible for the vaccine to change a person's genetic material. I don't know whether you wanted to add anything onto that question.
Completely agree with what you said, Dudu, and I think, you know, the wider, it is about where the information is coming from and where people are getting their information from. So, you know, I have a teenager. We see lots of misinformation, I should say, on some of the social media networks. Your best source of information is the NHS website to get your information from. There is no evidence that it changes the human DNA. And that is from the scientists, not from Belinda and Michelle. There's no evidence. Is there anything?
No, I've not heard of anything at all. No, and I think we would all have heard if there was.
That's great. And I'm actually just about to put into the chat some frequently asked questions on from our local NHS site, which I hope will be useful for people to be aware of and look at as well. And I think that's one of the really important things about this pandemic as a whole, and of course vaccination, is to be very cautious about where you actually do get your information from. I know that there's lots of WhatsApp groups and information shared through WhatsApp that is not always from sort of trusted sources, and I think that it's very easy to inadvertently even spread misinformation. So I think that this is a really important area where people should trust the NHS, who are really looking to provide accurate and open information to us as residents of the country. And so that's why I've put the link in there to our local NHS and the FAQ. I hope that's going to be useful for people. So we haven't had any questions through on our chat. And I've run out of questions that I have been asked before. So I'm just going to go round and ask whether there's anything else that we want to mention to people on the conversation as a last point. So Belinda and Michelle, is there anything that you would like to mention?
Really just, you know, a last parting word, just to give reassurance really to Enfield residents that the special school nursing service are very, very, very well trained. They are the same nurses that have been delivering vaccinations, other vaccinations other than COVID, to your children in school. We have a really good relationship with the schools and with parents as well. And, you know, in terms of COVID delivery, you can rest assured that we're going to do our absolute very best to make sure that once you've consented, your child is comfortable. If there are any issues, we will definitely contact you. And I think you've put our contact details in the chat, Dudu, or Louisa has. So yeah, just give us a call if you have any questions. Please do give us a call. And Michelle and other nurses in the team who are just as nice as Michelle will be there to answer your questions for you. And please do respond to us when we send the links out to you for you to consent to your child. If you don't want to consent, do still contact us and let us know what we can do to help in that process.
Yeah, actually on that, if you don't want your child to have any immunisation, if you could actually fill out the consent form anyway as a no, so that we can actually gauge how many parents have sort of said yes and said no. It's just really helpful for our figures, but obviously we would love to chat to you before you say no, so that we know that it's an informed decision. Thank you.
And I know that lots of people have asked me whether I have I have a son who's 15, and lots of people have asked me, did I allow him to have, did I consent for him to have the vaccination? And I was very pleased to consent for him to have the vaccination, because I knew that not only would it protect him from infection and the possibilities of long COVID and such like, but it also gave my family an added element of protection as well, and the wider community. And Belinda, I know that you've also got a child in that age group as well. I wondered whether you could mention your sort of personal story around that.
Yes, thank you, Didi. Yeah, you know, our boys are very similar ages, and that is the reason why I talked about the part where parents can prepare their child and have that conversation. So obviously we're going not by GILIC, by parental consent, but as I said, they've got autonomy. So, you know, we had a very serious conversations about the pros and the cons, many more pros and not many cons. And we consented, and he was vaccinated as well. And this was a couple of months back, so we should be due again to be booking in either to their school, to his school, or the National Booking Service round about January when schools return. Very happy to consent.
Thanks for that. Louisa, oh, we've got a question from Maureen. Maureen, are you able to put the question in the chat, or Louisa, are you able to unmute Maureen?
Maureen needs to put it in the chat, please. Louisa's just having some technical issues.
So Maureen, if you could pop your question in the chat, that would be great. You can find the chat by clicking on the speech bubble. So just whilst Maureen's doing that, Ngozi, are there any last questions that we haven't answered yet that you've thought about?
Not really from my end. The only thing I can think of is with looking at the whole approach for the family. I know we've had a few questions about housebound patients getting their vaccines, and so yeah, just a question around that.
Yeah, it's a really good question, and it is something we've been talking about locally. I think probably the best way, and Belinda and Michelle, you'll have a view on this, is through the National Booking Service. And you know, you can then book slots for all of the individuals within your household, and go together and receive your vaccinations together. I think it's a very efficient way of using your time. Make sure that everybody gets vaccinated together, and obviously you can support and help each other in that. In terms of housebound patients, another part of the organisation that Michelle and Belinda work for will be coming round to vaccinate all of our housebound patients with their booster jabs.
Thank you. Louisa just sent me a message. Maureen, I think you can unmute yourself if you're able to.
Here we go. I can see
got the question. Okay.
Now. Can we do something as service providers to encourage other BME communities and parents to let their children get the jab? Because it's the same parents who find it difficult to understand the importance of the jabs. Yes, absolutely. We are looking to get there's already been a huge amount of information out, and we've been engaging with some of the big churches and other religious organisations across Enfield. During the summer, we've also had quite a lot of various types of engagement activity going on with different communities across the borough, and we're looking to continue that. I think, Maureen, if you do have any ideas about how we can work with you to promote vaccination, I'd be really keen to have a more in-depth conversation with you. So I hope that's useful, but please do get in touch if you do have some ideas. Maureen, you should be able to speak now.
Am I unmuted now?
Yes, hi there, Maureen.
Hi. Yeah, I think the problem with BME communities, I mean, this is all over, right? Because I work with the African Health Policy Network. And the thing is, BME communities, they tend to listen much to religious leaders. So most of the words that come from religious leaders, they take them seriously.
Yeah.
So that's another key point. That's another key group that we can hit on, because I've also noticed that our children from school, they understand better about the jab. But when they take the message home, it's not welcomed the way we expect. So they tend to listen to their religious leaders, and we can do something like, I don't know, an intervention that we can do to hit on religious leaders so that they convey the message to them. That's when they take the uptake is a bit bigger, because it's very difficult. Kids can understand. I know my 5-year-old, 7-year grandkids, they understand this thing more than I do. The jargon, they understand it. But then it comes to the parents now.
Yeah. It's a great...
As Enfield, if we can do, I don't know how we can maybe work with Eva, or, you know, to bring parents here and there, every now and then, random parents, that would be great. Or the school, what do they call them? The school board, you know, talk to them, do some Zoom meetings whilst they are in their comfort zone, because this is going to be a challenge. Some kids, they want to take the jab, but mom is saying, you're not taking it because we don't take it. We are not taking it. I know some parents who are doing that, and makes it difficult for the kids.
Yeah, of course. And Maureen, they're fantastic points. So I'm really grateful for you to bring them up. We've got a network of faith leaders here in Enfield that we work with quite closely. So we're going to be putting out quite a bit of information about vaccination to the faith leaders. And I think really your points, you know, I've sort of interpreted them that we actually need to be doing more with our religious leaders than we are doing. So thank you for that point. I think it's really valuable. OK, so we are coming to the end of the webinar now. I do hope that it's been useful for you and that you've been able to get some of your questions answered. As we've mentioned, the information about how to contact Belinda and Michelle's team is in the chat. So please do feel free, if you have any further questions, to pop that in an email or give them a ring. We will be putting on more webinars, so please do keep an eye out for that and share the links to those as they come through in your social networks. It'd be great if we can get more people to attend webinars like this. So thank you once again to the panel, Belinda and Michelle, Louisa and Ngozi, and thanks to everybody who's joined. I hope you have a great rest of the day. Thank you. Bye-bye.
Thank you.